Fibroids are benign tumors which grow from the muscle layers of the uterus. They are the most common benign growths in females. What are the symptoms of fibroids? What causes fibroids? Can fibroids turn into cancer? Dr. Sherian Slater helps us to answer these and other questions in the following interview. Dr. Slater, welcome to Inside Story.
Good evening. I'm happy to be here.
Now, the 8th of March is recognized as International Women's Day, and we will be speaking about something that affects...
It's about 20%, 20 to 25% of women.
Okay. What are fibroids?
Well, fibroids are just growth in the muscle of the womb, what we call the womb or uterus. And it's, as you say, it affects more women. It can't affect men because men don't have uterus. So that's why it's principal for women.
So is it important for women to know about fibroids?
Well, it depends on whether it affects you, because if it affects you, then you need to know about it and to be knowledgeable in terms of the management and what you can do about it. Fibroids are, that's a local term for the growth, is leiomyoma or myoma, and they are not cancer. They are just benign, what we call benign growth, because it stays within the womb. It doesn't move anywhere else. It stays within the womb, and it should not cause death because it is not malignant, so it wouldn't cause death. But it may cause other problems or complications in a woman's life, which will make it important for that woman to know as much as possible about fibroids.
Now, you say it's not cancerous, but are there cases where it can lead to cancer?
In rare circumstance, and the only reason why you may say it becomes cancerous because the muscle itself, like any other structure within the body, can become a cancer. But it's not that the fibroid leads to a cancer.
Now, who gets fibroids?
Well, you wouldn't expect it in young people, and you'd expect it more in older people. And it is thought to be more due to the female hormones that we have, that our body produces, that causes the stimulation, the excessive stimulation of a particular part of the muscle wall of the womb, and therefore it forms a mass, and that is what we call fibroids. Now, it may also, we think it's more related with this hormone because in pregnancy it tends to grow more rapidly, and after pregnancy it tends to shrink. And when you go through menopause, that is when you no longer produces the female hormones, it tends to shrink as well. So unless it's really causing any problem to the woman, it can stay with you and you don't need to worry about it.
What are some of the symptoms?
Well, the symptoms that the fibroid produce is dependent on the size of the fibroid, because you may have fibroid and you get no problem with it at all. If it's very small, then it may not cause any problem. Now, depending on the size, depending on the location of where the fibroid is, because even though it arises from the muscle of the womb, it has a tendency to grow. So it can grow inward or it can grow outward. And then if it becomes, it may be more than one fibroid. You may have many fibroids of different sizes, and therefore the weight of the womb becomes much heavier, and therefore you may get pressure symptoms. So you may feel like a weight in the lower abdomen. Depending on its location, it may affect your period. So you may get heavy period flow. You can, depend on location again, you may get pain with the period. So that's when some patients may know. Or you may end up getting pregnant and can't keep the pregnancy because of the location of the fibroid. So it may cause a variety of complications or problems depending on the size and its location.
So there are different types of fibroids?
We wouldn't say different types because we talk about location of the fibroid, not the type, because type would suggest a different origin. Okay, so fibroid is fibroid, but depending on where it's located, you may say it's in the muscle, we say it's intramural fibroids, and you get your symptoms or the presentation according to that. Or if it goes, you know, the womb has the muscle, and over the muscle of the womb you have a what we call the serosa, the covering of it. Then the inner part, that's where the baby develops, is called the endometrium, and that's the mucosal part of the uterus. So the uterus has 3 parts to it. But the fibroids develop from the muscle. Now when it develops from the muscle, it may stay within the muscle, and it becomes an intramural fibroid and gives different problems. Or it may grow into the cavity where the baby should be. And there are some patients who may actually feel as if they're getting labor pain, and next thing you know, they're pushing out a fibroid. So the fibroid may actually grow inward into the cavity and eventually comes through the cervix and prolapse out. And you get pain and symptoms as if you were in labor. Or it may grow, instead of inward, it may grow outward. And then it may compress other structures like the bowel and so forth. Or, in certain circumstances, it may grow out so much that the blood supply that comes to the fibroid is cut off, and the fibroid becomes parasitic on the other structures like the bowel and the omentum that surrounds the uterus. So it becomes parasitic onto another structure, but it's not cancerous still. It's still a benign growth.